quite a high number of admissions yesterday. The hospitalizations continue to climb. So, what's our COVID census at GMH this morning? Good morning.
Good morning. Good morning, Guam. Good morning, everybody. As of this morning, at 6 o'clock, we are at 62, our census for COVID individuals in the house. And of the 62, nine of them are at the ICU level of care. And of the nine, four of them are on ventilator support. At the SIF up in Barragata Heights, the total number of individuals that we've moved and transferred over there since October 9 is 31. As of this morning, we are at six, which means quite a bit of them have been discharged home or to the ISOFAC, which is, which is a good sign. They've healed and have recovered, and so are able to go back home to be reunited with their families or to the ISOFAC and continue the isolation process until they are cleared by public health. So that's where we stand right now.
Can you tell us a little bit about yesterday? Because we saw the numbers that you reported the day before, and then just kind of doing the math. How many people were admitted to the hospital yesterday for the COVID?
Yesterday, there were 5 admissions of, I believe, 10 individuals who came into the emergency room with the symptoms, fever, shortness of breath, some with abdominal symptoms of, abdominal discomfort. Some were discharged, released home, or released to the ISOFAC, and then 5 were admitted to the hospital because of their oxygen level was below the 90 percentile. So they've had to be admitted and provided supplemental oxygen.
Lillian, has anyone passed away since
not since the 67th COVID-related fatality at GRMC. We haven't had one at our facility.
Okay.
Let's hope there isn't going to be any.
Why, did you hear something, Bree?
No. I was just looking at the numbers because last night there were 5 on the ventilator. It was in the JIC report, and then you just mentioned there were 4. So I just thought I'd ask.
Right. 4 adults on the ventilator. We do have one infant, but it's not a COVID infected infant. We do have an infant who is on the ventilator.
I see. So those numbers are kind of mixed up there, and they reported the infant on the ventilator along with the COVID patients on a ventilator. Is that what you're saying?
Yeah, possible.
Okay.
Any issues with the staff, Lillian? Any more staff catch the virus since we last spoke?
Yes, there were a few. You know what? I don't have the exact numbers, but there were some that I believe 2 or 3 individuals that tested positive. One of them was not at all in direct care with COVID patients, so that individual tested positive because of community, exposure, not hospital exposure, community exposure.
And then what about staff in terms of moving people around, having them at the different facilities? Because I know staffing's always been an issue, but as these hospitalizations continue to rise, how important are the imports that we have brought into the island to help with COVID?
Imports meaning staff?
Yeah.
Right. I think you said the 22nd you would start seeing some staff arrive.
Yeah.
Right. We're expecting, my understanding is there were 2 that arrived Sunday night, and then we're expecting 10 actually on the 22nd, which is tomorrow, from that staffing solution company. We're also expecting additional staffing support from the other staffing solution agencies. So, it's an ongoing basis that we're getting the additional staff because the numbers continue to, like today, 62. So, yes. The additional staff really just help with our situation here.
Have any of those staff that we brought in caught the virus?
None. They, not this recent batch. The first batch, as part of the pre-employment onboarding process, 2 of them tested positive, and so they were isolated before we put them to work in the units.
So they arrived on island. They were tested, and they popped positive.
Or as part of their onboarding process with their staffing solution, employer, they were tested before. Upon arrival, part of the onboarding process, that's for any new employee or any, people that we bring on board, that was part of the process, testing them. And there were two that for some reason, I guess, they tested negative before they left their place of, where they were.
Yeah.
And for some reason, maybe they just got exposed through their travel or right before they left. And yes, they tested positive when we tested them as part of the onboarding process.
Hey, Lillian, I'm not sure if you could tell us anything about this case, but there was something I'd seen on social media about with a woman whose husband was hospitalized, and I think on her post she said that this was his second COVID infection. I've seen a couple articles nationally, but is there any accuracy to that, or have you guys seen anybody who
was hospitalized and then for COVID, and then came back for another infection?
Okay, was hospitalized here at GMH for COVID, tested positive for COVID, and then seen again for another infection?
For COVID.
Okay, unless I get a little bit more details about it, I can't really comment. I don't have the information.
right
Have you seen cases like that though?
of reinfection?
I'm trying to think. We do have a couple that were discharged and have come back. Let me confirm that. Right now, there's so much information.
Right.
So, I have not really seen reinfection. It was possibly that they still did not clear the infection, but they did not have the symptoms to continue needing the hospitalization, were discharged home. But let me look into that further and get more information so that I can give you the accurate information.
Thank you.
Is that
Lillian.
just one case that you heard?
Well, when you look into it, if you find any others, feel free to share.
Or reinfection? Sure. I mean, that is definitely a possibility, and there have been cases in the mainland of reinfection.
Right. Yeah.
I wanted to follow up on the 10-month-old baby since we last spoke that was infected with COVID.
Okay.
Is that baby okay? And have there been any other babies or newborns that have contracted COVID?
You know what? Again, so many have come through ER, but none that has brought to my attention in terms of, an infant. The 10-month-old is still with us, and it is under, close observation. It's not on any, let me find out more, but yeah, the infant is still with us, the 10-month-old.
Receiving ICU level of care?
Yes, ma'am.
Just for clarification, the 6 that you said were at the SIF, that's part of the total GMH census, right, at the 62?
Correct. Put it in there. Yeah, fine.
I wanted to follow up also on just an article I read about the convalescent plasma therapy and GMH looking into administering that. Are you guys still looking into it? Or
yes, the medical director of our laboratory department is working on the protocols and the guidelines so that we make sure that, we are in alignment with how it is with CDC and in the mainland, how it is going to be ordered and administered. So all of that is being worked on by our medical lab team, the medical director and the lab administrator. And then we're going to vet it with the doctors and the medical director before we can actually implement that treatment protocol.
Is there a targeted time frame when you're plan to implement it?
Not yet. It hasn't been established yet, the time frame.
Okay. Thank you, Lillian. You good?
You're welcome.
You good?
Yeah.
Okay. Appreciate your time. Yeah, if you do get that info on the reinfection, because I think a lot of people are talking about that now, especially since it's come out in the national and international media.
Right. Yeah. So we still need to exercise the precautionary measures, wearing your mask.
I like your mask, by the way. It reminds me of picnic tablecloth.
No, I was actually going to say it looks like University of Alabama.
Or it could even be like a St. Francis. You remember St. Francis had the.
Yeah. Well, also given the fact that she's wearing that
Sinai?
Well, no, I was going to say the cardigan plus the houndstooth mask. She looks like a fan of the Alabama Crimson Tide. That's Bear Bryant, Coach Bear Bryant right there. So, roll Tide, Lillian.
Yeah. Don't mind our friend Jason. He's.
I'm somewhere else.
Okay.
Yeah.
Thank you, Lillian.
Thanks, Lillian.
Esta, okay. Wash your hands. Oh, by the way, there's a Navy biscuit, virtual Navy biscuit.
Okay, I'm
Yeah.
waiting for the lobster.
Oh, yeah.
Yeah, that's it.
Well, you got to come on tomorrow. Esta, okay. Okay.
Bye, Lillian.
9:28. We got to take a quick break. Coming up in just a bit. But first, let's just go to the Zoom room here where we have Christine Farron, who's the... hold on, okay, Chris, let me get your...
Forestry Division Chief for the
Right.
Department of Agriculture.
And she's also